Hi everyone, this is Shami from Dr. Story. COVID-19 has turned the world upside down. Everything has been impacted. How we live and interact with each other, how we work and communicate, how we move around and travel. Every aspect of our life has been affected. But life needs to move on to have a balance. As we know, COVID-19 hits the human's respiratory system, so we thought it would be ideal to have a chat with a pulmonologist. And today we have invited one of the best pulmonologists with immense knowledge and experience in treating all types of pulmonology diseases. He has a keen interest and expertise in the management of lung transplant, end-stage lung disease, respiratory failure, ECMO, ILD, and pulmonary hypertension. He has achieved gold medal in ENT and MD Respiratory Medicine. Dr. Apar Jindal, a warm welcome to Dr. Story's virtual studio. Thank you so much for joining us today. How are you doing? How is life in general? And how is life as a doctor in this ongoing pandemic?
Thank you for having me here. That's a tough question that you started with. So life in general and life in pandemic at this point of time, they just cannot be separated. I would like to say doing great, but I don't think that'll be a good answer to it. Looking at so many patients all around you, although, the best part about these days is that the numbers are coming down. We are seeing a good reduction in the actual positivity in the number of patients who are requiring ICU care, in the number of patients who are requiring hospitalizations. But then still the numbers are staggering. They're still mind-boggling. And although, on a personal level, it feels good, but professionally, you can't separate the life out. So long hours in the hospital, so much of mortality all around you. So definitely could have been better.
What is the general aspect of COVID-19 infection?
The general aspect of COVID-19, I think you've asked a very broad question, and that is, we can write volumes and volumes over this, but I'd like to, try to draw it out into a few sentences and in less amount of words over here. So COVID-19, we all know it's a virus. It is a virus from the coronavirus family, which always existed. We've seen two other severe diseases from this family of viruses, the SARS and the MERS epidemics as they were, which occurred in the previous years. This particular virus is highly virulent, means it is more infectious, it causes more disease in the body, and that is why it has taken the shape of a worldwide involvement or the pandemic. What this virus does in the body, let's talk a little bit about that. Once the virus enters into our respiratory system, which is through usually inhaled respiratory droplets. So if I am infected and I'm breathing out virus into the open air, I'm coughing and sneezing, and I'm spreading a virus cloud around me. So people who are close to me can pick up this virus. This virus starts internalizing in the back of the nose and the throat, which is called the nasopharynx area. And that is the area where we are actually swabbing to test whether the virus is present. And it further trickles down into the respiratory system, through your trachea, into your lungs. In these cells, the virus continues to grow, to multiply, to make duplicate copies of itself, and ultimately reaches a point where the cell cannot hold the virus anymore. It bursts open and releases the virus into the respiratory tract. Now, while all this is happening, various chemicals are produced in the body to, one, try to fight this virus, and second, try to stop the injury that the virus is causing. These are the cytokines. And it is this injury which is causing pneumonias, which is causing ARDS or severe pneumonia, where the patients are landing upon ventilators and ECMOs. And this is what is causing respiratory failure or lung failure in these patients. So I think this is just to sum it up in very few words, although it doesn't put it into proper context, but I think this is what the virus is doing in general.
We see that there is a considerable oxygen shortage in every now and then. Now, I'm not saying the oxygen producing companies are not supplying enough, but my point is, as an ordinary person, what we can do when we have breathing difficulties.
I think the question needs to be split. So when we have breathing difficulty, the first thing that we need to do is to assess ourselves. If you are feeling breathing difficulties, can be because of non-respiratory reasons, especially in these times also. Anxiety is a huge cause of breathing difficulty. If you're just having a high breathing rate, if you're just having a high respiratory rate, but your saturations are holding normal and you're not actually having problems inside your lungs, means you do not have pre-existing respiratory conditions, then we need to calm down first. We need to not panic, and we need to see whether that helps us to breathe better. We can try deep breathing techniques, breathing into a bag, trying to blow up a balloon, just doing deep breathing exercises. These are techniques that can help us relax and help us breathe better. But yes, if you are infected with the virus, or if you have a disease which is affecting your lung, then there is no other choice. You need to head out to the hospital. You need to be on oxygen. So if your oxygen is low, if the pulse oximeter is showing a desaturation, especially after doing a little bit of activity, there is something that we routinely advise our home care patients to check 6-minute walk test. That means by timing, they have to move around, they have to walk between two chairs which are placed in the hall or in the house at a considerable distance, whatever is the maximum distance, and they have to walk between those two chairs for about 6 minutes and look at the desaturation at that point of time. If there is a significant, that means more than 4% change, suppose you started at 96 and now you're at 90 or you're at 85, then that is a problem. That means you need to see a doctor. Or even before start, if it is less than 94, then definitely you need to see a doctor. You need to be on oxygen therapy along with the other treatments which will be required for the specific disease management.
Thank you for making it so easy to understand for people like us. Um, I have a question on that. What is the virus is actually doing in our lung for a layman to understand, like how it is affecting? We know it affects our respiratory system. It enters into our body by our mouth, our eyes, our nose. But what is actually it does inside the lung?
So a very good question. And I think it's an extension to the question that we answered earlier, the general aspects of the virus. Let's talk specifically about the lungs. So normally the lung is divided into different zones. There are the air tubes or the trachea and the bronchi, which carry air inside the lung. Then you reach the alveoli where the gas exchange takes place. These are like balloon-like sacs which are attached to blood vessels where the oxygen and carbon dioxide exchange takes place. Blood vessels is an important part of that. All this is held together by supporting tissue or connective tissue called as the interstitium of the lung. Usually, if you talk about infections, bacterial infections or pneumonias, they affect the alveolar part or the parenchyma as we call it. And that becomes filled with pus-like material that is called as a pneumonia. Now, there are some diseases which would affect the blood vessels by either making the blood vessels to shrink, like in pulmonary hypertension, or making the blood vessels to form clots inside them. Or there could be diseases which could affect the interstitium, wherein the oxygen and carbon dioxide exchange will be hampered because the space between the alveolus and the blood vessel where the exchange can happen becomes thick. It's called a diffusion barrier, and the gas exchange will not happen. COVID is a unique disease in the sense that it is causing all of these in different kinds of people. So once the virus enters into the lung, it starts with the process of pneumonia. That means the alveolar sacs, they start getting filled with pneumonia-like fluid, with pus-like materials. And this is called as consolidation. It's called solidification. Lung is a very soft, spongy tissue. But when it becomes hard, like the liver, that's called as a consolidation. And this is typically what is seen in pneumonias. Now, in about 85% of the cases, it'll just go away. Wherein small areas of the lungs will be involved with inflammation. That means some swelling will happen in the lungs from the cytokine injury, as I told you. In the remaining cases, it will progress to pneumonia, which may progress to ARDS. That means complete involvement of the lung. When you have more than about 70-80% of involvement of the lung, that is called as ARDS with a hampering of gas exchange. Now, beyond that, the virus moves. It's causing clots to appear into the blood vessels. Routinely, normally when we see clots in the lungs, it is usually clots which are formed in our legs or in the vessels in the pelvis area, and they travel into the lungs. But this is the virus which is causing clots to appear in the lungs itself. This is called as de novo thrombosis. That means new appearance of clots in the lungs. And when the lungs go into a complete stage of failure, what we are also seeing is fibrosis. So we have a huge experience of transplanting, doing lung transplants in patients who have undergone complete respiratory failure or lung failure because of COVID pneumonia, and the explant biopsies. That means the lungs, when they were removed, they showed that the complete interstitium is fibrosed. They had no chance of recovery because fibrosis is a permanent damage. So this is a virus which is affecting all the parts of the lung, and that is why it is more deadly. Now, to give you another perspective, these kind of diseases like interstitial lung diseases or clotting type of diseases, when they occur singly, it takes decades for the patient to travel from the appearance of disease to respiratory failure. But this virus is doing it in a matter of days. So we can gauge the virulence of the virus, the effects of the virus, the bad effects of the virus onto the lungs just by this timeline.
Thank you so much. You made it super easy for a layman to understand what it is doing. My next question is, sometimes a lot of people's PCR test is negative, but their lung is showing it has got affected. How their lung will recover from this situation, whether this will recover ever or not?
So a very good question. So let me again answer it in two parts. PCR test being negative, it has two aspects to it. One, the RTPCR itself is only about 70% sensitive. That means it would miss 30% of the cases. And that would depend upon the way that the swab has been taken, the way the swab has been transported. And with the new virus, it is also sometimes possible that the test may not pick up the new genes, the mutated genes, which may be in the virus. So therefore, a clinical correlation, that means looking at the symptoms, what the patient's condition is, along with the radiology, along with the imaging, that means the CT scan and the PCR report, we have to put everything into perspective and then declare the patient to be COVID positive or not. Having said that, there is also a chance that some of these patients over a period of time will become PCR negative, but they may still harbor the effects of the virus. So if you look at the international guidelines, everybody is considered to be non-infective after 3 weeks of time. Now, that means the relevance of the test being positive or negative does not hold true. But we need to look at what has happened in the lung. As I told you before also, 85% of these cases will just spontaneously recover. They will not need any sort of help. They will not need any sort of therapy, just support. If a little bit of oxygen is required, maybe that support, breathing exercises, and they will all recover. It's the remaining 15% which form the crux. Some of them will benefit with oxygen therapy, along with things like remdesivir, along with non-invasive ventilation. About 5% will move on to invasive ventilation, where we put in a tube and connect them to the ventilator. And of these also, about 1 to 2% will go into lung failure or respiratory failure, who would require therapies like ECMO, extracorporeal membrane oxygenation, which is like an artificial lung where the blood is removed from the body. It is passed through a machine which does the oxygen carbon dioxide exchange and then pumps it back into the body, or may finally end up in a lung transplant. That means replacement of the lungs with new ones because they have been permanently scarred by the disease. So this is how different people will react to this particular disease.
Thank you so much. My next question is, for people who came out of COVID-19 positive, how their lung will recover, what they should do for a faster recovery. Any tips?
I think general well-being of a patient is most important. We need to exercise regularly. We need to make sure that we are eating healthy. We are not, lockdown promotes a lot of fatty food behavior in people that has to be avoided. We need to make sure that if we have to go out, we practice COVID appropriate behavior. We are always wearing a mask. And I recommend wearing a surgical mask or an N95 mask rather than just, holding a handkerchief over your nose, because those things are scientifically proven to prevent this infection from spreading. So if you're wearing a mask and if I'm wearing a mask, the chance of any of us getting the COVID infection becomes negligible. So it's very important that all of us start practicing that. Other than that, my recommendation is good sleep, good food, regular exercise, stay healthy, stay indoors. So that's about it. And then the last important point that can be added to that is the vaccine. Everybody needs to get vaccinated. Now, there is a very small cohort of population. There is a very small particular type of patients for whom this vaccine is not recommended. So immediate post-transplant patients or immediate immunosuppressed patients who cannot handle the vaccine, where the chance of disease occurring because of the vaccine is more, those are the only people who do not get this vaccine. Otherwise, everybody above the age of 18 years as of now should get this vaccine as soon as possible.
Thank you. There are a lot of people has difficulties in understanding what the vaccine is doing, whether we should take it or not. Because when somebody died right after have taken the vaccine, probably it's not because of the vaccine. Maybe it is because of some other issues. But those news are getting highlighted, and people tend to believe that, okay, so this person has died, so I should not take this. This person had that difficulty, so I should not take it. Your answer make it much clearer to understand why we should take vaccines. My next question is how we can keep our lung healthy. What are the things we should do on a daily basis? Now, I know you said already that we should, as person's overall health is more important. I absolutely get that. But in this situation where we talk about like lung on a daily basis due to this COVID situation in the world, people are very affected and worried about their lung in general. So what a general person, like someone who doesn't have any other diseases, what that person can do to keep the lung healthy?
I think again it starts from the very simple, practices of eat healthy, sleep healthy, and exercise regularly. There are certain practices which are aimed particularly towards the lung. Things like deep breathing exercises. In yoga, a lot of people follow the pranayam, the alom vilom. Those sort of exercises help good. Simple blowing up a balloon, letting it go, blowing it up again. This is a very good healthy practice for the lung. It helps increase the lung ventilatory capacity, and that can be practiced very easily at homes. There are people who have actually bought incentive pyrometers. It's a small device with 3 balls, and you can practice blowing and you can practice inhaling on that with the level of the balls rising up. So these are certain good things. These are certain good exercises that can help the lung. Other than that, curtailing practices like smoking, abstaining from alcohol, these are certain things that need to be done. If you're living in a very dirty environment, if you're living in an environment where a lot of construction is going on around you, make sure that you have enough screens on your window so that you're not inhaling all that particulate material which is coming in from the open windows from the construction sites. If you're living in an area which is close to a factory, then I think practicing, holding a mask all day long is actually worth it to avoid all that smoke inhalation. Because these are things which cause a lot of depositional disorders in the lung. Let it be carbon, let it be silica, let it be other chemicals. When they go and deposit in the lungs, definitely they can cause so many other diseases as well. So we need to make sure that we are avoiding these sort of practices which actually cause problems to the lung, and just concentrate on staying healthy.
My next question is, we already have spoke about vaccines quite some time, but what is the vaccine affecting, how the vaccine is affecting our lung? What is the vaccine doing actually inside our body? Is it
Very
making our lung healthier or what?
So the vaccine is not making your lung healthy. See, what the vaccine is doing is the virus has certain proteins. Virus has certain attachments to the body. These are chemical interactions through which the virus is internalized into the cell. And that is when the process of the virus starts. It starts replicating. So different vaccines have different mechanisms of action. So that means they're targeting different processes in this entire viral life cycle. So some vaccines are preventing internalization of the virus per se. Some vaccines are preventing the replication of the virus. Some vaccines are preventing the exit of the virus. So all the vaccines are working by different mechanisms. It is basically through an antibody response. That means we are giving a small dose of an attenuated virus. Or if you look at the AstraZeneca vaccine, or if you look at the Pfizer vaccine, it is an mRNA vaccine. That means a subcomponent of the virus is being injected, which is creating antibodies against that. What these antibodies are, these are like memory cells. So these cells, they recognize this virus as soon as it enters into the body and try to inactivate it. Now, this does not mean that you cannot have coronavirus infection after being vaccinated. What it really means, what the protection it gives you is that if you are vaccinated, and by vaccinated, I mean you are protected. You've had 2 doses of the vaccine, and at least 2 weeks have passed after that. You have a good antibody response that you have mounted by the vaccine. Then, even if you get infected by the coronavirus, you will not have a serious disease, which may end up in pneumonia, ARDS, ventilator use. You will only have a mild disease, and you will get away with that. So the virus does not prevent you from getting the infection. It actually prevents you from getting serious disease.
We are talking about lung infection. So here's my next question is, what is the lung CT score means?
Good question. So lung CT score is nothing but the picture, the appearance of the lungs on the CT scan. So anatomically, our lungs are divided into different zones, different segments, if you can call that. So if you can clearly take it as 10 segments and 10 segments in both the lungs. And these segments have been given different scores according to their appearance. If they appear good, they're given a score of 0. If they appear very bad, they're given a score of 2. So when we sum total these scores from both the lungs, then we arrive at a score, which can be out of 25, which can be out of 40, depending upon what system of scoring is being used. So this scoring system is called the CT severity score. It basically signifies that how much portion of your lung is actually affected and to what degree it is affected. But again, reliance on this score to gauge whether the patient is serious or not is, I think, futile. It needs to be coupled with the clinical information, and it needs to be read by a doctor rather than a layman saying my score is 25 and your score is 13 means I'm more serious than you. It may not necessarily mean the same.
Thank you so much, Dr. Apar Jindal. We are almost at the end of the discussion. My last question would be, what do you think how long this COVID-19 situation will continue? What is our way out eventually? We know
I
that
wish
there
it
is
was.
no definite answer, but we still wanted to know your perspective.
Yeah, I wish it was over yesterday. So we are seeing a decline in the numbers. So from what it looks like over the next couple of months, maybe 1 to 2 months, there should be a substantial decrease in the new positives in the cases who are requiring ICU care. That means the sick cases. And hopefully this trend will continue. Now, there is some data coming in about a third mutagenicity, about a new strain emerging, and whether or not this winter we see another uprise in October or November with a third wave, it is yet to be seen. But I think if the particular COVID appropriate behavior can be practiced, if the vaccination program can be strengthened, we are ready to fight it. This vaccination, it looks like it is here to stay. Maybe for the next couple of years, at least we will have to practice this vaccination on a repeating basis, like the influenza vaccine is given every year to patients who need that. This vaccine may also need to be repeated as a booster dose, maybe 6 months, maybe 1 year. Again, the scientific evidence is yet to be released towards that. But hopefully, at the end of this wave, we will see a mitigation from COVID-19 disease.
Thank you very much, Dr. Apar Jindal. It was a very productive conversation with you. I firmly believe our audience will greatly benefit from your valuable tips. Looking forward to more fruitful conversation like this in the upcoming future. Thank you very much, everyone, for tuning in with us. If you are someone who wants to stay healthy and looking for some easy and inexpensive tips, then feel free to check out our other videos. Don't forget to like and share. And if you haven't subscribed our channel yet, you can do that now. See you around.